The Gauteng Health Department says 56 babies have been abandoned in the province between January and August this year. Most of these newborns have been left in facilities including Tembisa, Leratong, Charlotte Maxeke and Dr. George Mukhari hospitals. Socio-economic factors are said to be a driving force in this increase in child abandonment. So organizations including Door of Hope have been helping these babies find a home for many years now. Let's speak to its Director of Operations, Nadene Grabham, joins us via our video link this morning. Nadene, thanks so much for coming on. We're hoping to get your perspective on these numbers that the Gauteng Health Department have revealed. They're saying there's been an increase this year. Is that what you're seeing at Door of Hope as well?
Yes, good morning. Thank you so much for having me here this morning. Yes, I definitely think there has been an increase in baby abandonment, specifically since lockdown started. Just at Door of Hope in the last year and a half, we have received around 41 babies from hospitals. Not necessarily all of them abandoned. Some of them are consented adoptions. But if just one organization like Door of Hope has received 41 babies,
sure,
how many other organizations have received babies from hospitals? So I think that number is much higher than what is given.
So these are 41 babies that you've received from hospitals, and of course Door of Hope has its own initiative right there at your office in Johannesburg. Shall we call it your HQ? There is literally a little door in the wall, in your front wall, where parents can, or caregivers can literally put their children if they are unable to care for them.
Yes, that is correct. So Door of Hope started the first modern-day baby saver in the world in July 1999. And in the last also about year and a half, we've received 28 babies have been safely relinquished through our baby saver.
Nadene, what does this say to you about the current state of our country, and what leads parents to take a step like this, which of course isn't an easy decision to make?
Oh, I definitely think it's not an easy decision to make, but a baby saver is an alternative to unsafe baby abandonment. And sadly, the baby savers aren't actually recognized as a safe alternative in South Africa. Even though the idea started in South Africa, there's still a lot of stigmatism attached to the baby saver, but there are over 35 active baby savers in South Africa, where close to 500 babies have been safely relinquished through this baby savers. It's estimated that around 3,500 babies survive unsafe abandonment annually. So this just goes to show that baby abandonment is a big problem in South Africa, and we don't have safe haven laws. So when a mother leaves her baby in a hospital, it's still considered abandonment, which is a criminal offense. So I think as a government should really start focusing on implementing safe haven laws in South Africa and seeing a baby saver as a safe alternative to unsafe abandonment. Poverty has a big role to play in baby abandonment, but also late-term illegal abortions and gender-based violence, rape and teenage pregnancies. These are all factors that can lead to child abandonment, and these are really big issues that is going to take a lot of work and a lot of effort to get sorted, but it can be done.
I mean, this issue of abandonment, which, as you say, is a criminal offense in our country, these 3,500 babies that survive unsafe abandonment, I mean, we're talking about babies that are left in a veld, for example, and in much more dangerous conditions. If 3,500 are surviving that kind of abandonment, how many more are not?
Well, research shows that for every baby found alive, 2 are found dead. So that pushes the figures to around 10,000 babies abandoned annually. So
we need a change in legislation, don't we then, Nadene? Because if I'm not able to take care of my child, as you say, at the moment, if a mother just walks out of hospital, that is considered abandonment. But if I'm not able to take care of my child, the legislation needs to change.
It definitely needs to change. So that is why I co-founded Baby Savers South Africa together with Dr. Whitney Rosenberg. We put together a law proposal that has been presented to Parliament to change the narrative from abandonment to safe relinquishment if a parent uses a baby saver. But baby savers is not the only solution. It is a solution, but safe haven laws, like many other countries in the world has, and it's proven to work. We need to start looking at safe haven laws.
Yeah, absolutely. I mean, of the children that have been, as you say, safely relinquished at Door of Hope, started in 1999, what's your tally at the moment, Nadene?
So far, we've received 259 babies through our Baby Saver, but we've received close to 1,900 babies into our care. So sometimes a parent may consider using a Baby Saver, but she decides to ring the doorbell instead, and we can then offer option counseling. In some cases, these mothers want to give their babies for adoption because they don't have the necessities to care for this baby, like food, clothes, blankets. Wherever possible, we help the mommy with that so that she can at least keep her baby. That should be the last reason anybody should keep a child for adoption, because they don't have clothes or food for the child. So 1,900 babies have been saved through Door of Hope, one of many organizations across the country.
And as you say, mothers are able to ring the doorbell there and come inside, and you can have that discussion with them. But for someone who might be listening to this discussion this morning, Nadene, give us a sense of how we get a hold of Door of Hope if indeed we are in this situation.
Many people have access to social media, especially Facebook free mode. We are Door of Hope SA, and then Baby Savers is also on Facebook. We do respond to all the messages we receive from mommies, and that's as Baby Savers SA. And even if you're not in Johannesburg, doesn't matter where you are in the country, we will put you in touch with somebody that will be able to help you.
Nadene Grabham.
There's hope.
Yeah, absolutely. And I'll tweet those contact details as well. Nadene Grabham is the Operations Director at Door of Hope. Incredible work being done by that organization for many, many years now. Nadene, thanks for coming on.